Hello everybody, a very warm welcome to this webinar today. This is the first in our spring series of webinars from the HCPC focusing on the revised standard of proficiency from the Health and Care Professions Councils. Thank you very much to everyone for joining us today. So today I'll introduce some of the background information on the updates to the standards of proficiency, and we will then explore some of the specific updates which focus on the central role of the service user. So just to clarify, this event will be 45 minutes long today and we'll try to run to time. So we'll take a few further moments to allow our many attendees to join this virtual learning space today. I'm so pleased to say that we're expecting a large number of attendees. Upwards of 1,900 people have registered for this event, which is wonderful. And I'm delighted to say that we are welcoming individual registrants of all of the 15 main professional groups regulated by the HCPC, also including their employers, representatives of professional bodies, and last but by no means least, members of the public are also joining us today. So many thanks to absolutely everyone for attending. Your time is in high demand and we greatly appreciate you joining us today. Thank you from everyone at the HCPC. So let me run over some brief housekeeping information for today's session. So in order to protect the learning environment in events of this scale, we are required, unfortunately, to automatically disable all cameras and microphones today, but we will use the Q&A function here on MS Teams for you to engage with us today, and you should see that along the top bar of your Microsoft Teams window today. We may not be able to answer all questions, but please do pop any questions that you have in there, and we will endeavour to publish many of them for everyone to see. We'll also choose a small number to discuss identified points throughout this session. Now, if your comments or questions haven't been answered or indeed covered in any of the learning content today, then you will be able to submit these via a form that will be issued to all registrants in a follow-up email that we send to you. And my colleagues will post in the Q&A now some information on what you can expect in that follow-up email after today. It is really important to say that we cannot respond to specific questions about your individual practice in the Q&A box. So if your question is about this, then we do recommend that you contact your professional body or your union, as they will definitely be able to support you here. And there is a list of our professional bodies on our website if anyone is unsure. Also in the Q&A box today, we've got some information on how to engage with us on social media, both during and after today's webinar. Please do engage with us on this if you can. And also if you encounter any technical difficulties in this Microsoft Teams live event today, we do have a team on hand to help you with any technical issues that you might have. So again, if you post in the question and answer box, we will respond to these, but we're likely to respond privately unless it's an issue that affects every attendee today. This event is being recorded, so for everyone watching this as a recording at a later date, a very warm welcome is extended to you too. And if you're watching the recording, whilst you might not be able to participate or you will not be able to participate in the live interactions that are planned for today, you are invited to contact us if you do have any questions after the session. So at the end of today's webinar, we will ask you to complete an evaluation form because we need to understand your experiences and we want some support to develop and improve our webinars. So for those of you interested also in receiving a certificate of attendance, you'll be linked to this once you've completed the evaluation form from us. So by way of introduction, my name is Fiona Campbell and I work here at the HCPC as a professional liaison consultant. So together with 4 colleagues across the 4 countries of the UK, we deliver the professional liaison service. And this is a service which seeks to influence and support the development of cultures and practices that enable our HCPC registrants to embed and achieve high professional standards. So I myself am an HCPC registered speech and language therapist, and I have a career history working in the NHS and the university sector in Scotland. My scope of practice in clinical work is adults with acquired language and communication disorders. And I think it's fair to say, like many of you today, I have a strong clinical interest in how we support the people who use our services to be fully and meaningfully involved in their care. I'm joined by colleagues in the background today who will be manning the Q&A and offering all sorts of technical help, many of whom are also registrants of the HCPC. It's important to say that here at the HCPC we recognise through your attendance at this event today that there is a significant amount of expertise in the room in terms of involving service users in their care, and there will be very many ways in which all registrants are currently achieving this at a very, very high standard. So we have joined the session today to understand more about what the new standards of proficiency about to launch from September 2023, what they say about involving the service user. And to begin, I have a question for you that I would encourage you to reflect on. And my question is, what examples of good practice in involving service users could I share with other people? And so for those of you who are willing, you're kindly invited to share your own examples of good practice in service user involvement over the entire course of today's session. So let's remind ourselves of the purpose of the standards of proficiency before we dig into the content of today's session. As a reminder, the standards of proficiency, sometimes known as the SOPs, are our professional standards for all registrants, and all registrants must meet those standards in order to join the HCPC register. Importantly, they set out the threshold standards that are considered necessary to protect the public. So the standards include generic standards which apply to every one of our registrants, as well as profession-specific standards. The standards of proficiency set out clear expectations of a registrant's knowledge and abilities when they start practicing, and registrants must continue to meet the standards of proficiency that apply to their scope of practice. The question then is, why are some of the standards of proficiency changing? Well, here at the HCPC, we know, because you tell us, that the range of people our registrants work with, the diverse environments in which you work, and the different interventions that you offer are changing. So as a result, service delivery can sometimes be described as no longer linear, and there is a need for revision to the standards to reflect the subtleties of this. They were last updated in 2015, and updates really help ensure that the standards are relevant to current practice, that they're fit for purpose, and that they champion high quality care that the public can access safely and with confidence. As part of our review of the standards of proficiency, we conducted some extensive stakeholder engagement over a 3-year period from 2019 to 2022, and we consulted on these revisions to the standards in 2020. In doing so, we engaged with members of the general public, patient groups, employers, registrants, education providers, professional bodies and unions, to name but a few. So let's take a look at what has changed in the standards of proficiency. Overall, there's a greater focus in many of the standards on how we foreground the patients and service users and involve them in their care. We have also elevated the importance of registrants' mental health and well-being and ways in which they can look after their own mental well-being with the support of others. We've also expanded the role of equality, diversity and inclusion, and we've emphasised the role and importance of leadership at all levels of practice. We've further emphasised the need to be able to keep up to date with digital skills and new technologies. A new standard exists about promoting public health and preventing ill health in line with current practice for all registrants. The wording of the standard moves away from registrants having a passive understanding of standards towards active implementation of the standards. And there are also specific changes to the standards for a number of different professions. The one we're going to focus in on today, of course, is the way in which the standards of proficiency have changed in terms of how we involve service users in their care. So these exist across a range of different standards rather than just one individual section of the standards. Standard 2 of the standards of proficiency for all professions focuses on registrants practicing within the legal and ethical boundaries of their profession. So standard 2 sees some changes. We've got increased focus on promotion and protection of the service user interest. We've got some statements about maintaining the rights, dignity, values and autonomy of service users. And we've also got some statements around how our relationships with service users exist and how they should be based on mutual respect and trust. As we move towards standard 6 of all of the standards for all professional groups, this is about how we understand, and this is our confidentiality standard, how we understand the importance of and how we maintain confidentiality. And we have some strengthened statements in here about registrants' awareness of working with people who have communication support needs, who may have additional people present, such as interpreters, support members, family, translators, that type of thing. Standard 7 is our standard on communicating effectively, and by far, to me, this is a specific standard which has seen the most significant updates in relation to expectations for communicating with service users. So, for example, Standard 7.1 places focus on us as registrants having appropriate verbal and non-verbal skills when we communicate with service users, carers, colleagues and other people. We also see some strengthened statements around understanding how a service user, or rather the role the service user wants to play in a consultation, and providing service users with the information that they need in an accessible way. We also place some focus on how registrants' ability to be able to modify their communication to address and support the individual needs of people that we are working with, and to actively remove any barriers to communication where possible. Standard 7.6 also sees an improvement, if you like, in the way that we support the needs of service users and carers, especially when we may have to use interpreters. And Standard 7.8 has some strengthened statements around how we provide that information to service users to allow them to make informed decisions in an accessible way. Standard 8 is our standard that focuses on working appropriately with others. And so we've got some strengthened statements on partnership working with service users, carers, colleagues and other people. Standard 8.5 is about us identifying and actively responding to signs of stress, anxiety and stress in our service users, carers and colleagues, adapting and providing that support where necessary. And as we move towards the end of the standards that have further centralised the service user, Standard 11 and Standard 13 focus on assuring the quality of your practice and on drawing on important knowledge and skills. So we see some increased statements here around how we use feedback and information, including qualitative and quantitative data to gather service user responses to their care and how we evaluate that. And Standard 13 for some of our registrants will be around how we engage service users in any active research that we are doing as appropriate. These changes to the standards of proficiency are really important, especially those ones around centralising the service user, because in fact we've got evidence. National improvement standards tell us that when people are involved in their individual care and their treatment, that their self-esteem improves. We know that outcomes are much better for people when people have choices and control over their treatments. And we also know that people who are invited to feed back on services and shape future care report enhanced quality of life, improved relationships between staff and service users. And interestingly, it also leads to improved outcomes for providers. Our stance here at the HCPC is that many of our registrants are over-delivering already on these standards, and that these standards are there to really reflect what is happening in current practice and raise it to standard level for everyone. I think I'm going to come to my colleague now at this point to ask whether there are any questions that have come in that would be useful to address about these changes to the standards. Kim, can I pass over to you?
Yeah, thanks, Fiona. I just wanted to say that the Slido polling has gone wild. People are sharing the most amazing things that they've been involved in with service users, for example, exactly as you said, involving service users in research design, asking for feedback when environments need refurbishing, and evaluating the quality of practice. So it's absolutely amazing. But we do have a question, if that's all right, Fiona, and I'm going to ask Matt if he would come into this. Matt was very instrumental in designing the updated standards. So Matt, the question is, how do I incorporate this, exactly what Fiona's been talking about, into my CPD, and do I need to demonstrate these updated standards at all to the HCPC? I wondered if you could answer that, Matt, if you wouldn't mind.
Yeah, thanks a lot. So this is a question that we get, or some version of it, quite a lot. A lot of people are obviously concerned about how they demonstrate they meet the new standards. And the first thing I just want to point out is that outside of your normal renewal process, where you'll be asked to declare that you are able to meet the standards, you don't have to take any steps with the HCPC to demonstrate that you meet the new standards. So there isn't anything you need to fill in or tick or anything with us in order to continue practicing. What we would always advise people to do is to have a look at the new standards. We have a gap analysis tool that helps you look at what the standards are, assess them against your current practice, and see where there might be gaps in order to focus your CPD on that. like all your other CPD, you should be able to keep records of it. You should link it to your learning. It should be varied. And if your CPD is ever audited, that is something that you'll then be able to prove your ability to meet the standards linked against that CPD. Just also want to point out, while we say you need to focus your CPD on any gaps, your CPD doesn't need to cover the whole of the new standards, for example. So you won't have to demonstrate that your CPD focuses on all of the new standards or pointing out how each single standard of proficiency is met. You need to be able to meet the new standards of proficiency insofar as they're relevant to your scope of practice, and you need to use your CPD to try guide that in order to make sure you're able to practice safely and effectively for your scope.
Thanks, Matt. That's really appreciated. Thanks, Fiona.
Thank you very much. We'll have a chance to come back and look at some more questions later. Kim, I'm very relieved that you said the Slido had gone wild, because I did wonder whether it was working in the background, so it's wonderful to know. Please do continue to contribute to that, everyone. It would be really, really great to be able to collate this and send it out to you after the event. So for the remainder of today's session, I would quite like to place some focus on the changes to Standard 7 of the Standard of Proficiency, which are the standards around us communicating effectively. So as a very brief reminder, these include things that we've already discussed, like effective and appropriate verbal and non-verbal skills to communicate with service users and carers, how we modify our communication, how we remove barriers to communication, how we provide information in accessible formats, and how we work with service users and or their carers to facilitate a service user's preferred role in decision making. And in order to do that, what better way really to do this than to hear directly from a person with communication support needs, Jan, and her daughter Carly. So Jan has aphasia. So for those of you who may not know about this condition, aphasia is a language and communication disorder. It affects more than 350,000 people in the United Kingdom, according to the most recent statistics from the Stroke Association. And around a third of people who've had a stroke will experience aphasia. So aphasia can affect a person's ability to understand speech, to speak, to read, write, and or use numbers. I was really delighted that Jan and Carly, who I've followed on social media for a long time, agreed to be interviewed by me for the purposes of this webinar to discuss her communication difficulties, some of the challenges that they both face when interacting with health and care professionals, and some of the advice that they have to share to registrants of the HCPC around some of the new standards and any gaps that we may have in some of our skills. I'm going to leave it to Jan to introduce herself more fully in this first clip, but both Jan and Carly then go on, following their introduction, to share with us some of the helpful things that people can do to support Jan's communication and some of the things that they do that are in fact a bit unhelpful.
Mexico, a holiday, Kieran, a son, yeah, yeah,
I wasn't there.
yeah, see, no, photos, see everywhere, lovely hotels,
You
yeah.
just collapsed on
Yeah.
holiday, didn't you?
Yeah, so I mean,
stroke, yeah.
so
When
something
was it?
happened.
Mm-hmm.
You had a stroke.
Yes.
And was that a long time ago, Jan?
She's written July 5th, 2005,
Wow.
just to be precise.
Absolutely, just to be precise. So that's,
Yeah.
goodness, that's nearly 18 years ago.
Yeah, voice, you, yeah, I, nothing, or voice, nothing. Yeah, awful.
But I'd say mum's gesture, her patience, being willing to write things down, because if she can't say the word, often she'll trigger the word by starting to write it. She does a lot of air writing.
Yeah.
And numbers are really, really tricky for mum.
Yeah. It's what? What is lovely.
Yeah. So she's writing like all the numbers out in a
Like a number
row. So
line.
I know
when
it is.
yeah, so when numbers are written down, she can visually see them. They make complete sense to her. But if she hears numbers verbally, it doesn't mean anything. So if anyone tries to make an appointment over the telephone, for instance, it's really really tricky.
Sounds quite stressful as well.
Yeah, so if we ever make even between us two, if we make any plans over the telephone, it always has to be backed up with a text. Someone you've never met before has a conversation with you, but it's good. What sort of things do they do that help?
I told a speech stroke. Yeah. Oh, it's all right. It's very soulsome. So
I'm not sure which words you're trying to say. So you tell people that you've had a stroke.
yeah.
And it helps if people are understanding.
Here, very good, smart. Talk. Yeah. Talk.
So when people treat you like you're a smart person,
Yeah.
so that they don't talk down to you, or
yeah, happens a lot. Wheelchairs. Yeah.
people speak to you.
Yeah, differently. Yeah.
That's interesting, Jan, and certainly it's something that I can, I've heard many times before from people with aphasia that
Yes.
there are some things that people can do to help, but some things that people do are very unhelpful.
Yes.
And could you tell me about the things that people do that are unhelpful, things that don't help you?
Leave it alone. People no.
What you're trying to And do you want me to say?
Yeah,
If people interrupting, but I didn't want to interrupt her saying.
Yes.
I don't want people to interrupt. But when people they try to be helpful, and it's not often done, people being horrible, but people think they're being helpful by going, do you mean this? Do you mean this? Do you mean this? And every time someone interrupts you, it makes it worse, doesn't it?
Yes.
So our first clip there, I'm sure that you'll agree with me, was an interesting one. From the perspective as a speech and language therapist, there's so much that this lady is able to do, that Jan is able to do as a communicator, but in fact, so many things that are very difficult for her. It was an interesting clip in terms of reflection about how Carly, her daughter, over many years has learned to support Jan's communication, because there were some beautiful examples of communication support in the video there. We move on a little bit here to Jan and Carly sharing some experiences of interacting with health and care professionals. And I'm interested to hear what you think about some of these. And I pose some reflection questions to you after this, based on what you hear.
It's just even though whatever department you go to, whether it's like outpatient stuff, inpatient stuff, no one talks to each other. And so one person might know mum has aphasia, but the next person you speak to won't. And there might be a note on the system that says, any phone calls, can they please go to the daughter? But they'll still revert to the main phone number, which is mum's, and then they'll phone mum instead. So then mum will get a phone call where, yeah, we don't, and then she can't take the information on the phone.
No.
And then is worried because she understands someone is. Yeah, but we just recently we had the when your foot was bad.
Yeah.
Went to go and see somebody, and they spoke to you like you weren't very smart. That she could tell like maybe she had, lower intelligence or a learning disability, or there was dementia or whatever they thought was wrong with her, but they didn't support her communication. And mum actually in the appointment phoned me, gave the lady the phone, and she said, oh, your mum's very confused. She's really not confused. She's really not confused at all. She absolutely knows why she's there, what she needs to happen, and it just wasn't well handled, was it?
Yeah.
There's lots and lots of examples where mum's tried to phone, or someone's tried to phone mum, and then you're not able to do it over the phone, and then it takes a few days to wait for a letter to maybe arrive, or I have to then phone and try and chase who's made the phone call and why. Stuff like that's really frustrating.
Yeah.
It's pretty much every interaction mum has with healthcare, there's an issue, and it's very rarely an individual person who's causing upset or problems. It's usually like a system error, or but you get people who just speak, don't have awareness of aphasia, so they don't know how to speak to mum, so they do
slowly, yeah.
And so many health appointments are time pressured because we understand that's how it is, but it means that she isn't given time, and you get question, and although like you were saying, Fiona, there's some people with aphasia have really significant difficulties with understanding information. Mum, luckily in that area, is pretty good. Like she understands things pretty well, but if you give her more than one question at a time, or give her more than one instruction at a time, it's game over. and so yeah, and also because mum's a very proud and capable woman, she doesn't like to admit that she hasn't understood as well, so sometimes she masks a bit. You do. You do have examples of when people have done it well with you?
Yeah. Volunteers.
Yeah, but in healthcare.
Yeah.
It's usually once people have the information they need about mum, or I've gone once and then I feel comfortable that she would be okay with them. It's usually when we would feel most confident. You know, if I go, when I've had my COVID vaccines, I know I can go in a room and I'm going to just be talked to like I'm an intelligent adult, and immediately people don't do that with mum. And it's something about, and it's not huge, big, horrible behaviours. It's just very subtle. I'll just be like, how are you today? Like, you know, just the way they change their voice and just, you know, go. And then if I'm there, they directly talk to me, which immediately says, you know.
I found this clip really interesting, and I'd encourage you also to do some reflection on some of the contents of that particular clip. And I'm really interested in some of the simple changes that might be possible to bring about in a service to ensure really that Jan wouldn't experience some of the problems that she has faced if in fact she was interacting with you or any of your colleagues in your service. I'm sure that many people are used to supporting people with communication support needs, but perhaps you aren't. What simple things might you be able to put in place that would allow you, your service and you and the care that you deliver to really meet Jan's needs? I was very interested in Jan and Carly reflecting on the system issues, talking about the fact that some of these issues really impact on the experience of communicating with health professionals. They mentioned in particular the time-limited appointments, and I know from practice that some of those system difficulties can really feel out of our control. And I'm interested in you doing your own personal reflection really on which of the system issues might exist in your services and what could you do about it to change some of those to give a better experience to service users who are experiencing, you know, the need for additional time and support. As my conversation Carly and Jan moved on, we discussed Jan's experiences of people making assumptions about her ability to make decisions, and I picked this photograph to share. All photographs have been picked with their permission from social media to really highlight some of the challenging issues that Jan experiences when people refer to her daughter Carly as the main decision maker in her care. So we had a very interesting conversation with them both, or I had a very interesting conversation with them both about the role that Carly would in fact like to take in her mum's health consultations and how healthcare professionals could really help facilitate this. And then it leads to a lovely conversation about what it means to feel truly respected by health and care professionals. And my prompt to you throughout this video is to consider how you might relate this to your practice and consider anything that you might be able to do differently based on their experiences. Do you ever notice that people might talk over the top of you or ask Carly or assume that Carly is the decision maker?
Yeah, 100. Yeah.
Yeah. It's really hard because if I'm there, it's almost the assumption that I'm there because mum's incapable. And if I'm not there, she gets treated like she's incapable anyway. So it's a kind of a no-win situation. But as I'm sure you can imagine, Fiona, I'm not like I'm not a quiet wallflower. If I'm in a situation where I know someone's doing something that's just not helpful, I do let them know. But always in an opportunity to learn. I would never be rude or unkind. I just say it in a, you know, actually mum really does understand what you're saying. I would love to just go to an appointment and just be a facilitator. So I can just kind of explain. I always just say, you know, mum had a stroke, she's got communication difficulty called aphasia. She understands everything you say, please don't give her too much information at once. And mum can write down things and yeah, you should be fine. And then I can kind of take a step back. That's the most helpful way that a situation can be. Yeah. And then empower mum to be the person who they get the information from. Although you're saying no, it doesn't happen all the time. What behaviours would show you that someone respected you?
Malcolm, you, intelligent,
So people talk directly to you?
Yes.
Not to me or Dad?
No.
Mm.
Hmm.
Not baby voice?
Yeah.
Don't shout?
Oh. Right. Right. Yeah. Yeah. A shout. How
Does
are
that-
you?
Does that happen a lot?
Yeah.
Oh, goodness.
Twice. Yeah.
Based on that, our conversation went on really to discuss ways in which Jan could be better involved in her care. And Jan and Carly have a lovely discussion about this in the next clip to follow. And what I think is lovely about this clip is that they go on to offer some advice to health professionals who may in fact feel quite nervous about their communication skills. Many of us are not exposed to this routinely, do not necessarily have to support people with communication support needs on a daily basis, but want to do the very best we can by our service users. So I'm interested in your views on this clip, and I posed some reflection questions to you after this clip. This is the last of our clips today.
Yeah, we were at a hospital last week where Mum was doing some work for our local hospital. Yeah, and we were asked like what just some of the things that the hospital trust could change that would make things better. And it was like, if just like your GP is copied in on communications, it would be amazing if there was a designated family member that could be copied in on communications, and just flagging systems that highlight a communication need, and maybe even go as far to say what helps that person, like almost like an attached communication passport, or just something that helped people, because it's such a broad
Very good.
last week.
Yeah, it's amazing.
Yeah, it was good.
Yeah. No.
I think be comfortable with silence.
Yeah. Yeah. Yeah.
But it's when I first, because obviously when it's my mum, I can be, you know, I'm not always a great communication partner, and if I'm not, it's fine because it's my mum and we have off days. But when I've worked with lots of other people with communication difficulties, you have to get used to just silence being okay, and the other person will be appreciating that you're giving them time.
Time.
Yeah.
Yeah. You fine. Yeah. Fiona is fine. Another. Yeah.
Just being, I always just think at the core of it, if you treat someone like they're an intelligent human, you're kind, you give them time, everything else will flow. And I just don't ever pretend to know.
Yes. Oh.
Yeah.
What?
But it's the most patronising thing that can happen to a person.
Yeah.
If you've got to that point where you literally don't know what they're talking about, and you just pretend that you do because you feel embarrassed. That's really makes a person feel awful.
Oh yeah.
So me, quite often, like, we know each other inside out, got a very close relationship, but at least multiple times a week we'll be talking about something, and we've either got cross wires and we're talking about two very different things, or I've got no clue what she's talking about at all. But it's fine just to say, I'm really sorry, I'm not understanding what you're saying right now, and just be honest about it. Put it back on yourself. Just say, I don't understand, I'm sorry. What can we can we go back a few steps to what, you know, try and unpick where we've gone wrong?
Yeah. Yeah.
And my experience is that people are quite fearful of doing that. They don't like doing that, you know, they cover it up, or they
turn awful, embarrassed. Yeah.
Yeah, people do. It is a really awkward situation, and most people who work in the care professions, like, you do it because you're a caring, kind person, and most people, it comes from a good place that they're just trying to make someone feel uncomfortable.
Yeah.
But with aphasia, like, the person is not silly, so they're totally picking up on when you're blagging.
Yeah.
So my prompts to you really today, based on particularly that last clip, is for you to think about how you would rate your own communication skills, communicating with someone with communication support needs, such as aphasia, like Jan, and things that you might be able to do to improve or support other people to improve if in fact you feel quite skilled at this yourself. And an important reflection question is also, what would your service users say that you do well in terms of your interactions with them? We were so grateful to Jan and Carly for their time and sharing some of their experiences today. Some of the summary of the changes really that I'd like to articulate today, just as we approach the end of the session, is that we know that registrants are already offering care in the best interest of your service users, and the changes to the standards of proficiency are really asking you to broaden how you think about those interests and where those interests may require a little more scrutiny. We would like registrants to be more mindful, or to continue to be mindful, of the impact of communication disabilities and other disabilities on involvement, and what additional steps someone could take to be more fully involved in their care. And where a service user is not able to be as involved as they might like, registrants should really think about documenting that, and also the steps that they've taken to involve relevant others. I'll come at this point to any questions that may be in chat, but I also realise we're running quite short of time today, so I'll pop over to my colleague Kim and see if there's anything that we can address from the Q&A function today.
No, it's fine. Thanks, Fiona. We'll make sure that if we haven't answered your question, that we do answer it after the event. I just wanted to sort of commend people in the Slido we've got 74 examples of sharing good practice, which is pretty amazing, and some really amazing ideas. So thanks, Fiona.
Thank you so much. Thank you so much, everyone, for this. I'm so much looking forward to reading that. Some HCPC information for you is we will be compiling a resource list to send out in our after event email. We also have some further My HCPC Standards events running, so they run every fortnight now until the middle of June, and we look forward to leading those with you. The next one up is on registrants' mental health and wellbeing, followed by a session on equality, diversity and inclusion, then leadership, and then one on the new standards for digital skills and new technology. Also, to remind you, if you don't already know, that the consultation is open for the review of the Standard of Conduct, Performance and Ethics, one of the other main sets of standards that we have that is under review at this time. The consultation is open, and we'll send you some links as to how to take part in that consultation. Your involvement would be greatly valued. Please stay connected with us at the HCPC. Give us a follow on Facebook or on Twitter, LinkedIn, and follow us on YouTube on the HCPC, where a copy of this video and others from the My Standards series will be presented. Thank you very much for attending today's session. I've greatly enjoyed leading it. It's been a huge privilege, and I want to extend special thanks to Jan and Carly for the great time they took with me. I had a wonderful conversation with them to help me think about standards and how they apply in practice to an individual with communication support needs and her family member who supports her. I hope it's given you some food for thought. Many thanks, everyone.